common concern for both plastic surgeons and patients is how accurate are the results we're getting from any preoperative simulation. And so it is a hesitancy on the surgeon's part. They only want to deliver on what they can. And the patient's anxious, of course, about what the results are going to be. I have a fair amount of experience in what we used before Arbrea. And so I know what I can anticipate when I'm talking about a specific implant or a specific procedure. In my mind's eye, I know what I'm going to deliver. My experience with Arbrea is nearly 100% of the time, I'm confident that it's representing what I would anticipate. If it isn't, I'm very adept to say, hey, look, it's just not rendering well for you. I think it's going to look a little more like this or like that. But that's rare. I would say close to 100% of the time, I'm saying, yeah, I think this is what I would anticipate. And so it actually tends to be quite accurate. Now, that's anecdotal, I know. There are some studies out there confirming that or giving some strength to that. But my personal experience is that. I'm very comfortable to say, yes, this is what I can deliver for you. So when I consider the utility of preoperative simulation or Arbrea in our clinic, we use it to help verify our plan. So the plan still involves manual measurements of the patient so that we know the breast footprint, for example, and we can match the implant to that footprint. It still is a physical assessment of the patient, proportions, all of those things. But with this, it helps us to verify what our plan would be. If I'm considering for all of those indicators, the cup size, the proportions, all of that, I have in my mind what I would choose. Well, this gives us a visual to say, yeah, that is going to match well, and she would be happy with that. And so it's another tool to use to verify what we're thinking and to give a patient some reassurance and some confidence to say, okay, I'm happy with that result. So as you become more familiar using the Arbrea app, you'll find that it actually has a lot of utilities that can be employed to help make the adjustments that you would anticipate making in surgery. It is fairly intuitive just to start up and use for a straightforward breast augmentation or placement of an implant. As you get to more complicated revisions, combination augmentation, reduction, mastopexy, maybe some congenital changes that you need to account for, thankfully it has the ability to take that into account, and you can unilaterally make adjustments. You can account for different volumes. You can see from different perspectives how that's going to make an effect. It is a little more involved, and so with some use, you'll be able to find those tools and use those tools to your advantage, which takes some time for sure. But those are the more complicated, the more complex cases to do that with. So what I've found in my experience is, early iterations of simulation or imaging kind of just exploded the breast. It just kind of distorted in what they thought was bigger or wider or whatever. Really, the utility and the preciseness of the Arbrea is you can fine tune that to what you know you're going to achieve in the operating room. For example, if I'm doing an augmentation mastopexy, I know that the implant itself is going to change maybe nipple height position, fullness in the upper pole, but I also need to account for what I'm going to lift, where I'm going to reposition the breast mound. And so lifting the lower border, inframammary fold, you can do that with the Arbrea. So you can see that. So it isn't just fuller and enhanced up here with the same heavy ptotic breast. That actually has an improved contour and an elevated inframammary fold. So all of those things can be adjusted to what I know I'm going to do in the operating room.